Are you or a loved one struggling with opioid addiction? If so, there's a breakthrough medication that could offer hope and a path to recovery. Introducing Sublocade, the innovative treatment that is revolutionizing opioid addiction therapy. In this video, we will explore how Sublocade is transforming the landscape of addiction treatment with its unique approach and remarkable results. The opioid addiction crisis, an overview. The opioid addiction crisis has been a pressing issue for many years. According to the National Institute on Drug Abuse, NIDA, more than 130 people die every day in the United States due to opioid-related overdoses. The opioid epidemic has affected people from all walks of life, leading to devastating consequences for individuals, families, and communities. Many individuals with opioid addiction struggle to quit because of the intense cravings and withdrawal symptoms they experience when they try to stop. Traditional treatment methods, such as detoxification and counseling, have been effective for some but may not be enough for others. This is where medication-assisted treatment, MAT, comes into play. MAT combines medication with counseling and behavioral therapies to provide a comprehensive approach to addiction treatment. Buprenorphine, a medication that helps reduce opioid cravings and withdrawal symptoms, is a commonly used medication in MAT. Sublocade, a monthly injection that contains buprenorphine, is a new addition to the MAT landscape. Understanding Sublocade, how it works. Sublocade is a long-acting, sustained-release formulation of buprenorphine. The medication is injected into the abdominal area by a healthcare provider once a month. Sublocade slowly releases buprenorphine into the body, providing consistent therapeutic levels that help reduce cravings and withdrawal symptoms. Sublocade, the extended-release formulation of buprenorphine, falls under the category of medications known as partial opioid agonists. It's designed to treat adults with moderate to severe opioid use disorder. Buprenorphine, the primary active ingredient, works by binding to the same receptors in the brain that opioids like heroin and pain relievers bind to, but it does so more weakly, helping to ease withdrawal symptoms and cravings without producing the same intense high. Unlike traditional oral medications, Sublocade eliminates the need for daily dosing. This improves convenience and ensures consistent therapeutic levels in the body, enhancing its efficacy. The extended-release formulation also helps minimize the risk of misuse or diversion, addressing common concerns in addiction treatment. Benefits of Sublocade for opioid addiction treatment. Sublocade offers several benefits over traditional oral medications for opioid addiction treatment. The monthly injection provides sustained delivery of buprenorphine, eliminating the need for daily dosing. This improves medication adherence and ensures consistent therapeutic levels in the body, enhancing its efficacy. The extended-release formulation also helps minimize the risk of misuse or diversion, addressing common concerns in addiction treatment. With Sublocade, patients can focus on their recovery journey without the burden of daily medication management. Moreover, Sublocade has been shown to improve retention in treatment and reduce illicit opioid use. In clinical trials, patients receiving Sublocade had lower rates of opioid use and were more likely to remain in treatment compared to those receiving a placebo. Sublocade's unique approach to opioid addiction treatment has the potential to improve outcomes and reduce the risk of relapse. Clinical trials and research on Sublocade. Sublocade has undergone several clinical trials to evaluate its safety and efficacy. In a randomized, double-blind, placebo-controlled study, Sublocade was shown to be superior to placebo in reducing illicit opioid use and retaining patients in treatment. The study involved 200 participants who received either Sublocade or a placebo injection monthly for 24 weeks. Another study evaluated the safety and efficacy of Sublocade in patients with moderate to severe opioid use disorder. The study involved 848 participants who received Sublocade for up to 24 weeks. The study found that Sublocade was well tolerated and effective in reducing opioid use and craving. Sublocade treatment process. What to expect? Sublocade is administered by a healthcare provider as a monthly injection into the abdominal area. Before starting Sublocade, patients must first undergo a period of induction, where they receive an oral buprenorphine medication to ensure they are stable on the medication before transitioning to Sublocade. During the induction period, patients will work closely with their healthcare provider to determine the appropriate dose of buprenorphine. Once stabilized, patients can begin receiving Sublocade injections. Patients should continue to receive counseling and behavioral therapies as part of their addiction treatment. Side effects and safety considerations of Sublocade. Sublocade is generally well tolerated, but like any medication, it can cause side effects. Common side effects of Sublocade include constipation, headache, nausea, injection site reactions, and drowsiness. Serious side effects, such as respiratory depression and liver injury, are rare but can occur. Sublocade should be used with caution in patients with a history of respiratory depression, liver disease, or adrenal insufficiency. Patients should also inform their healthcare provider of any other medications they are taking, including over-the-counter medications and supplements, as they may interact with Sublocade. Success stories and patient testimonials. Sublocade has helped many individuals with opioid addiction achieve and maintain recovery. One patient, who had struggled with opioid addiction for years, shared that Sublocade gave her the stability and structure she needed to stay on the path of recovery. Another patient, who had tried other MAT options without success, shared that Sublocade was the only medication that helped him overcome his cravings and withdrawal symptoms. Comparing Sublocade with other medication-assisted treatments. Sublocade is one of several medication-assisted treatments available for opioid addiction. Other medications commonly used in MAT include methadone and oral buprenorphine. Methadone is a long-acting opioid agonist that is administered daily in a clinic. Oral buprenorphine is taken daily either as a film or tablet. Sublocade offers several advantages over methadone and oral buprenorphine. It provides sustained delivery of buprenorphine, eliminating the need for daily dosing. The extended-release formulation also helps minimize the risk of misuse or diversion, addressing common concerns in addiction treatment. Accessing Sublocade, insurance coverage and cost considerations. Sublocade is a prescription medication that requires a healthcare provider's supervision. The cost of Sublocade may vary depending on insurance coverage and other factors. Patients should check with their insurance provider to determine coverage and cost. Several patient assistance programs are available to help offset the cost of Sublocade. Indivior, the manufacturer of Sublocade, offers a patient assistance program that provides financial assistance to eligible patients who cannot afford the medication. Patients can also apply for assistance through nonprofit organizations and charities that provide financial assistance for addiction treatment. The role of Sublocade in combating opioid use disorder. Sublocade plays a crucial role in the battle against opioid addiction. Its unique extended-release formulation, coupled with its effectiveness in managing cravings and withdrawal, positions it as a vital tool in comprehensive opioid use disorder treatment plans. When used in conjunction with counseling and therapy, Sublocade can significantly improve the chances of a successful recovery. Conclusion: the potential of Sublocade in combating the opioid epidemic. Sublocade is a breakthrough medication that offers hope and a path to recovery for those struggling with opioid addiction. Its sustained-release formulation provides consistent therapeutic levels of buprenorphine, enhancing its effectiveness and improving convenience. Sublocade's unique approach to opioid addiction treatment has the potential to improve outcomes and reduce the risk of relapse. While Sublocade is not a magic bullet for opioid addiction, it is a valuable tool in the fight against the opioid epidemic. Combined with counseling and behavioral therapies, Sublocade can help individuals achieve and maintain recovery. If you or a loved one is struggling with opioid addiction, talk to your healthcare provider about Sublocade and other MAT options that may be right for you. In the face of the opioid crisis, Sublocade stands as a beacon of hope. Its innovative approach to opioid use disorder treatment, providing a sustained release of buprenorphine, sets it apart in the realm of addiction medicine. As we continue to grapple with the opioid epidemic, Sublocade offers a glimpse of a future where effective, long-term treatment for opioid dependence is readily available. However, it's imperative to work closely with healthcare professionals to determine the appropriateness of Sublocade for an individual's specific circumstances. With ongoing research and advancements in addiction medicine, Sublocade holds the promise of brighter and healthier tomorrows for individuals seeking to break free from the chains of opioid addiction. Thanks for watching.